Welcome to UMCC Medical Consultants Connector, where your health matters to us. Rheumatic heart disease, or RHD, is a serious condition. It affects the heart valves. RHD is a result of damage caused by rheumatic fever. Rheumatic fever is an inflammatory disease. It can develop after an untreated strep throat infection. Strep throat is caused by group A Streptococcus bacteria. This bacteria is quite common. If strep throat is not treated, it can lead to rheumatic fever. Rheumatic fever can then cause permanent damage to the heart valves. This damage is what we call RHD. RHD is a global health concern. It affects millions of people. It is more common in developing countries. This is due to limited access to healthcare and antibiotics. RHD can affect people of all ages. However, it is most common in children and young adults. The good news is that RHD is preventable. Early detection and treatment of strep throat are crucial. Understanding RHD is the first step towards prevention. This essay will discuss the causes, symptoms, diagnosis, and treatment of RHD. Rheumatic heart disease, or RHD, doesn't appear out of nowhere. It starts with an infection, usually strep throat, caused by the group A Streptococcus bacteria. When this infection isn't treated properly, the body's defense system, the immune system, can mistakenly attack its own tissues. Think of it like this. The immune system is like the body's security guard. Its job is to identify and fight off harmful invaders like bacteria and viruses. But sometimes the security guard gets confused and mistakes a friendly face for a foe. In the case of RHD, the confused security guard attacks the heart valves. This attack leads to inflammation and scarring of the heart valves. Over time, the damage can make it hard for the valves to open and close properly. This disrupts the normal flow of blood through the heart, forcing it to work harder. Several factors can increase the risk of developing RHD. These include repeated strep infections, a family history of the disease, and living in crowded conditions. Rheumatic heart disease, or RHD, can be silent for years. It may not show any symptoms in the early stages. However, as the damage to the heart valves worsens, symptoms begin to emerge. These symptoms can vary from person to person and can range from mild to severe. One of the most common symptoms of RHD is shortness of breath. People with RHD may find it difficult to breathe, especially during physical activity or when lying down. This shortness of breath happens because the damaged heart valves make it harder for the heart to pump blood efficiently. Other common symptoms include chest pain or discomfort, fatigue, and swelling in the legs, ankles, or feet. Some people may also experience heart palpitations, which are feelings of a rapid or irregular heartbeat. In some cases, RHD can lead to complications such as heart failure or stroke. Section 4. Diagnosing rheumatic heart disease. Diagnosing rheumatic heart disease, or RHD, is like putting together a puzzle. Doctors use a combination of tools and information to get a clear picture of what's going on. The first piece of the puzzle is the patient's medical history. Doctors will ask about any past episodes of strep throat, rheumatic fever, or heart problems. They'll also inquire about any family history of these conditions. The next step is a physical exam. Doctors listen to the heart with a stethoscope, checking for any abnormal sounds like murmurs, which can indicate valve problems. The most important test for diagnosing RHD is an echocardiogram, or echo. This test uses sound waves to create images of the heart, allowing doctors to see the valves in action and assess any damage. Other tests, such as electrocardiograms or EKGs and chest X-rays, might also be used to check for heart rhythm abnormalities and fluid buildup. Section 5. Treatment and prevention, a path to a healthier heart. While there's no cure for rheumatic heart disease, or RHD, the good news is that it can be managed effectively with treatment and, most importantly, prevented. Treatment for RHD focuses on controlling symptoms, preventing further damage to the heart, and reducing the risk of complications. Medications play a crucial role in managing RHD. Doctors may prescribe antibiotics to prevent recurrent strep infections, which can worsen valve damage. Other medications, such as diuretics, help remove excess fluid from the body, while blood thinners reduce the risk of blood clots and stroke. In some cases, surgery might be necessary to repair or replace damaged heart valves. This is typically considered when medications alone are not enough to manage symptoms or prevent complications. Prevention, however, remains the most powerful tool against RHD. The key is to promptly treat strep throat with antibiotics, usually penicillin or amoxicillin. This helps prevent the infection from triggering the immune system's attack on the heart valves. Vaccines against strep throat are in development and hold great promise for future prevention efforts. UMCC, your ultimate medical consultant connectors.